There are two facets to that question. So the first thing is new cases are sort of steady state in terms of acquisition. So that speaks a lot to education, prevention, use of PrEP and PEP, all of these things that have helped, and also, in other parts of the world, comprehensive HIV prevention programs. Over half of the people living in the United States with HIV are age 50 and over. And that speaks to the efficacy of antiretroviral therapy over the years. And what was once a potential treatment that was minimally effective then became highly effective but hugely burdensome in terms of dosing, pill counts, and side effects, and now has streamlined to often, once daily, once monthly, inject pills or injections respectively. And I expect that will continue to progress.
Most people, the majority of people, once effective therapy became available, they were living. They lived longer. And now, survival of everybody with HIV on average is about 85% of that in of the general population. Now, obviously, there are subgroups. There's some persons with certain lifestyle habits whose survival, even on treatment, is not as good as the general population because there's other issues which affect their health. There's other groups of people who are responding very well who actually live longer on average than people in the general population. Why? Because they're followed and they are proactively thinking about we're very aware of the health problems that occur in people with HIV, which can occur prematurely. So we're if anything, they may be getting better management, better, being proactive about health issues than the general population. How you are immunologically is what determines your risk of getting age-related complications, common age-related complications. And they tend to occur on average 10 years earlier in persons with HIV, well-controlled HIV. In other words, they're undetectable, etc.
We really do see survivor's guilt. So people who have lost their community early on. HIV was so traumatic in the 80s and 90s, a lot of times because of the stigma, but may have been ostracized from their family or maybe been ostracized from a faith community. We know that people aging with HIV have a 5 times higher rate of depression, higher rates of anxiety. And it's estimated, again, there's lots of research out there, but 31% of people aging with HIV experience isolation, I think, due to, a lot of these issues. Also, just as people are aging, they if someone is in the LGBTQ community, they may or may not have, children, or if someone was HIV positive for 40 years, they may have not, even if they're heterosexual, may have chosen not to have children, even though now we know that people can be HIV positive and have a child and it'll be okay. Collaborations are just so important. Historically, due to stigma and due just to our healthcare system, HIV has kind of been siloed. And a patient might be going to their HIV clinic and all their needs are being met by this wonderful multidisciplinary team. But we're finding as people are aging, it's not enough. There are challenges at the HIV clinics because there's so many patients and there's just not enough staff. So one of the things that we're doing in New York State is this wonderful collaboration between our pilot programs and the New York State Office for Aging, because there's so many aging services out there. So the HIV siloed community doesn't necessarily know about all the aging services, and the aging community doesn't necessarily know about HIV. They're thinking like HIV is no longer a thing. Like we don't have people that are HIV positive in our programs. And they do. So we're doing a lot of cross education. We're doing a lot of collaborative efforts. We're doing a lot of outreach between these different programs, which I think is essential. I know it's happening in other places of the nation too. I've been to conferences. I know this is happening. We started this, a number of years ago. We have a lot more work to do, but I think that's something I would say that this is a national conversation. Really promote the idea of cross collaboration between state agencies and between communities, between different disciplines and different areas of focus. So we can't just take HIV as a siloed piece of the pie and not work with other areas like the aging piece of the pie. It's one big pie.